Okay, so yes, my name is Chris Elkin. I'm from Piota, and this presentation is titled Inclusion Through Innovation. So just a little bit about me. I've been in this industry for more years than I can remember. The last couple of years I've been with Piota, but prior to that, I spent 10 years working for the NHS, creating digital media online content. So initially looking at e-learning for internal teams, internal staff, facilities teams, etc. And then moved on into developing learning management systems, apps around learning passports and revalidation. I managed the Trust intranet, or at least my team managed the Trust intranet and internet. So fairly well versed with the challenges faced by NHS organisations when looking to communicate messages to their staff. The last sort of paragraph there is about my interest. I'm passionate, really, especially within the NHS, about making people's lives easy. People sign up to work for the NHS to work with patients, or predominantly a lot of them, to provide good healthcare. So the more we can provide, or the more we can give them the information, the tools, the support electronically, the more time they've got to do the job that they signed up for, i.e., caring for people. So really passionate about trying to save people money by using technology. And the last statement there is about don't make me think. The second part of this is if you've got to think about what you're trying to do or what you're trying to achieve on an app or on a system, it's probably too difficult. It should be very natural, and people should just be able to navigate through the different screens and different sections to find the information they need. So it's all about making it easy for people. And I think the easier we can make it, the more likely that people will engage and start to use these different systems. As an organisation, we've been in the healthcare market for about 3-4 years now. As an organisation, we've been around for about 5 or 6. But we're working now with over 80 different clients. So right at the very top, we're working with NHS England and Public Health Wales, through CCGs and obviously the integrated care systems now, to different trusts and different teams within those different trusts. So a wide spectrum of clients. Our app is very much a template-driven solution. So we've got an application that we can quickly tailor to meet the needs of your organisation, the needs of your team, the needs of your patients or families and carers. So all our apps look similar. This is a staff engagement app for an organisation in the Northwest. This app was aimed at young children coming into hospital for an operation. So looking to reduce the anxiety around their visits and providing lots of information up front in a nice format that they could sort of review before they came to hospital. We do transition apps for different organisations, very similar to the app we just described, but for a much older audience. Funny enough, we've done for University Hospitals in Birmingham and Samuel and West Birmingham, like the last speaker. We've produced apps for their junior doctors whilst at work, been able to pull out the phones at any time, at any minute, and find guidelines, protocols, etc. This is a patient app for NHS Ayrshire and Arran, aimed at parents of children, and it's all about sort of healthy weight and how that works with diabetes, and so on. So as I say, all our apps look similar. It is a template solution which allows us to respond very, very quickly. But top half of the screen, a bit of a logo, and then the bottom half of the screen, this 3x3 grid, is the tiles or the menu system. There's a few more apps there. So what I'm going to do now is to demonstrate or talk a little bit further about some of the apps, and especially recently, everything that's happened, during the pandemic and before that, to be honest, trying to ensure that people are feeling well looked after, that they are included, that they have got the support that the organisation's offering. And what we have found through kind of conversations that digital is great, but in some instances it's excluded people from the conversation. Some of the clinical staff, some of the sort of domestics that don't have regular access to IT, that can't access their emails during work, where a lot of this information is being distributed electronically, they've just got no access to it whatsoever. So in these instances, a lot of this important information just isn't feeding through. It's just not getting through to the people that really need it. So we're finding, that more people now, or more organisations, are looking at mobile. and the ability to be able to deliver some of their support directly to their colleagues, via mobile phone apps. So yeah, this really sort of, just sort of sums up that kind of thought where people are at work. It's so busy, especially in clinical areas. Maybe one or two PCs on the nurse's station, perhaps one in sister's office. But for most folks, it's very difficult to be able to get onto or access the intranet or the internet to be able to get information they kind of need. It's only when the people get home, perhaps, that somebody tells them about a support network that's been available, or a training opportunity, or some other piece of information that they get the opportunity to actually sit down and think about it. So we're all using phones more and more these days. The ability for the organisation to be able to push information out to colleagues using their devices, which they can access then wherever they want to, is the primary driver for a lot of the work that we're doing at the moment. So this is a app we put together for a local trust, and this is aimed specifically at their facilities management and estates colleagues. Oops, there we go, try that. So yeah, this is aimed at their colleagues. So they've, as an organisation, a lot of the information that they provide to this particular audience is done through managers, cascaded down from team meetings or one-to-ones and different things, and they just couldn't keep abreast, or the managers couldn't keep their people updated with everything that's happening, especially during the pandemic, where things were moving very, very quickly. And this audience were on the front line and needed to know that information, so we kind of created an app with them. This is the front page and the front menu, but all of the staff initially need to register on the app, so it's not like anybody can just pick up the app, a member of the general public, and start reading the protocols or the different alerts and notifications. People will need to register first to be able to see the information. And then on the app itself, they've got lots of different news, lots of good stories that are happening, lots of things that are happening around the organisation that they want to ensure that their colleagues understand and kind of know about. Different, again, I think this is an example of one of the pages there itself. So this is just sort of a typical page with an image, some heading text, and some body text. This is great. So they've been able to provide access to the intranet itself. So rather than reinvent the wheel in some instances, they're working with their IT section there. Their colleagues can actually log on to Netty, which is their intranet, and access some of the information directly from Netty from their phone. So again, previously they were excluded from accessing Netty because they've got no computers to be able to access them, but they've all got these little supercomputers in the pocket, and they can access them, the Netty and all that good information from wherever they are, whenever they want to. We've got things like access to the learning passports, so they can go and look at their training updates. In some instances, for some of the organisations we work with, they can go and do some training. And again, it's all accessible from their device. They can do this wherever and whenever they want to. Obviously, there's lots of staff benefits available to people. Again, this is another area where we hear a lot of anecdotal feedback that people just don't know what's available to them. There's lots of discounts out there available, lots of networks, lots of different events that are happening throughout the organisation. But for a lot of the time, some of these staff just aren't aware of them, and again feel kind of excluded and not part of the team. Where being able to provide again, the app on their devices, they can see everything that's happening and what they can do and how they can go and use it. So this is a wellbeing map. So you can get the gist of it. This is there's one for a hospital in Derby. They can access the ESR system. So it's not direct access. You'll click on a link here, and it'll take you to the ESR system of this organisation. They can go and get the pay slips or the P60s, or look up the employment history, whatever it might be. But again, it's just making all that available in one place. People don't have to think about it too much. They've got a question, they want to go and access a system, they want to go and find out a particular benefit or an event, they can go to the app. It's all there, it's all in one place. We've got push notifications on apps, so I think, on average we're looking at our phones about 3.5 hours a day. A little glance here, a little glance there. What's happening on Facebook, anything on Twitter, has anyone posted Insta, whatever that might be. But same principle. On the phone itself, we've got the app icon, and you'll get a little alert, a little push notification saying some new information, there's a new protocol, there's a new event that's been taking place. As a user, you can see those. So it's a really good way of reaching out to people directly, straight into the pockets. Contacts directory. I think one of the colleagues before who was doing the last talk was talking about point of contacts. Who do I speak to? One of the presentations before that was about mediation. So again, who can I reach out to and have these conversations with? So what this organisation doing is providing a list of all the different teams, of all the different people. Clicking on any of these buttons will take you straight through to that department. It's not taking you through to the hospital switchboard. It'll take you directly through to that extension. And again, it just makes life a hell of a lot easier. If you can press a button and speak to somebody, you don't have to start putting a phone number into a phone and thinking about the extension number and waiting for the receptionist to answer. That can be very time consuming and you can put people off. If you can press a button and get straight through to people, it's a lot easier and people are more likely to do it. Similar but different. So this is St Helena Knowsley. Again, this is a staff app aimed at their colleagues, wanting to keep everybody abreast of everything that's happening within the organisation. So different network events. They've got a whole section on the different IT platforms that they're running. So Teams, NHS.net email, ESR, any systems that you might need to work remotely and you can't remember what the link is to it or where I go or what it does. Everything's on this app. And again, as an end user, I can go and find my app out, go and find a link, press the link and kind of off I go. I'm up and running. I don't have to go and ask somebody or speak to somebody. It's all in one place. It's all with me wherever I am, at whatever time I want to access it. Again, lots of different benefits for the colleagues there. They can scroll through and see what's available to them. Again, with my alerts, so lots of different things are happening within the organisation, whether it's raising concerns or whether it's different campaigns or different apps that you might want to use to help out. Everything's all in one place, and they're using this to keep everybody abreast very, very quickly of what's happening, regardless of where you work. So, in some instances, admin staff will have access to the internet, can access their emails, so it's not necessarily an issue for them. But as I say, a lot more clinical staff, your domestic staff, don't have that capability. So, again, having this in the tunic pocket or in the bag or locked away somewhere, they can come back to it, and all that information is waiting for them. This was a great one, which we saw being run through the pandemic. The application itself has a forms section, so you can create different forms, whether they're holiday request forms or feedback forms, friends and family type forms for patients, or whatever else it might be. But this organisation was rebadged it and called it Pulse Check. So they were sending out little, how are you feeling today? What's the leadership been like? Have you got enough PPE? Are you comfortable with the training? Are you comfortable with this? Just so they could get a bit of a pulse, they could take the pulse of the organisation, see how people were feeling. It was quick and easy to do, quick and easy to deploy. It wasn't like the staff survey, which takes a little bit of time to A, complete and B, analysed. It was just very pinpointed and very specific at different teams about different things, so they could identify potential issues quite quickly, and then send transformation girls and boys in there to sort any of these problems out before they turn into issues. So again, just a great way of how we're using forms within the app itself, but how that application then can be used within the organisation to help. Finally, on the staff apps, this one is one for the Dudley group. So this one's specific for a team, and this is a great app. Really, really like this particular one. The consultant that's led on this has put a lot of work into it. But this app is just specifically for the team at the Dudley group. Same scenario, not enough computers for people to be able to sit leisurely and go and find information that they need. Very, very busy department, so the computers are very much clinical based, as they should be. But there's lots of information there that people just need to access and can't access for whatever reason, it just makes their lives, slightly more difficult, slightly more stressful. So we have to put a lot of this information onto the app and be able to distribute this app and share it between his team members as paid dividends within this particular team. But if we just go through it, same principle, people need to register on the app first and foremost. So it's only good members of the team that can actually access the information. But once you're in there, all of the policies, procedures, standard operating procedures, etc., they're all in one place, and people can kind of go and find those. They can click on any of these documents and they'll find a PDF version or the Word version of that particular document. Lots of guidelines for different areas, so it just wasn't adults, there's peds in there as well. Again, lots of different guidelines which people can just go and access. They've got access to the rota. So even though the rota is internally, again, they've provided access, a web interface into it, so their team can access the staff rota, again, from wherever they are. They don't have to be, at work and logging into the system to be able to access the rota. They can do it from, wherever. And I think the consultant here obviously spoke with his colleagues and just what would you like to see? How can we make it more accessible? How can we make your lives easier in terms of, disseminating some of this information? And these are some of the suggestions and ideas that kind of came back from his team. So these are the different forms. Again, they've got annual leave forms, they've got handover sheets which they use within the organisation. There's no patient data stored within these. It's more about, how was the shift and were there any challenges or any, problems, any issues, how can we resolve those? But, using all of the forms in different ways to be able to make the team much more efficient and much more data-led. Not trying to get a chat with somebody after shift's finished, or try and pass some information of the management chain, using these forms quickly and easily, so they can capture that and then disseminate it to whoever needs to use it. Similarly, a big old directory of different consultants. So again, you could get straight through to people if you needed to. Any of these call buttons would take you either through to their mobile or through to their desk phone. Lots of information on training, and again, giving people the ability to go and do the training where they want to do it at a time that's suitable for themselves. So, if work isn't that place, and isn't for a lot of people, the busy workplace isn't that easy to train within, and they can come onto the system, access the training, and then get all that sort of marked and submitted. Different links to different organisations, and again, it all comes back to a bit of an ethos of ours is almost having this sort of one-stop shop. All the information that the colleagues need, all of the access to the different systems they want, can all be put on within the app, and then they can they use that wherever they are, whenever they are, to be able to access that information. Whether that be a policy, or whether it be the rota, or whether it be a bit of training, whatever it might be, it's always available in your pocket. Last but not least, so there were 3 examples of applications we put together for staff and colleagues, but it's the same app and same principle essentially, about improving the patient experience. So providing them with information where they can find it quickly and easily. Got any questions, got any thoughts, any ideas, we can just go to the app, put it out here, wherever it is, and start accessing it. So this one's a quick demonstration for Morecambe Bay Maternity Unit. As you can see, it's the same solution essentially. Top half is their logo, and the bottom half is 3x3 grid, is the tiles or the menu system, and this is where the information is stored and kept. Again, the whole idea is you can look at it, it's relatively easy to get to the section that you need to go and find the information that you want. This was right at the very beginning, pregnancy referral forms. Once you've gone through the referral forms, you can then go and have a look round, a virtual look around the birthing centres. So you can embed YouTube videos into the pages, so you can start to then bring in your YouTube content into the app. Lots of different guidelines for expecting parents, or for new parents. Again, a contacts list, contacts directory, priceless. You're not scrambling around in the middle of the night, or whatever time, to try and find that number. Where is it? You can pull out your phone within 2 or 3 clicks, or on your phone, you're calling that team directly. Just makes it so much easier for everybody involved. Again, using alerts for different things that are happening. And that is a quick one through that. I've rushed through this a little bit, so I'm more than happy to do offline demonstrations where we can talk a little bit more in detail. But just a little bit about the app. Piotr itself stands for put it on the app. As I say, it's a bit of a one-stop shop where we're bringing all different information in, putting it all into one place and making it accessible by your audience, whether that's internal audiences or external audiences. Or in some instances, some teams will commission an app where the primary function is for patients, but there is a staff element in there where there could be guidelines or care plans or contact information where staff can use it at the same time. So a big repository of information. We license it on an annual basis, so costs start at about £2,000 a year. It is so cheap for kind of what you're getting. There's always a setup fee. So, you can be, most organisations take a 2 or 3 year deal. We can get you up and running, relatively quickly. In some instances, on the same day, for, very little sort of money. It is very, very inexpensive for what it is. The app comes in two aspects. So you've got a content management system. We provide you with training and show you how to use this. It's super simple. And you, a member of your team, a colleague, an administrator can come in and start creating the content. There'll be initial content that gets uploaded first. Then it's a matter of maintenance, whether it be daily updates or weekly updates or whatever it might be. But those two elements will provide you training, will provide you support throughout the lifetime of the contract, and that could be 1, 2, or 3 years. Quick one about process. Super simple. If you're interested after this, let us know and we can give you a more targeted, more focused demonstration conversation. As I said previously, we've probably got about 80 or 90 healthcare apps out there. So for whatever your team, whatever the condition, whatever you're thinking about, we've probably got something that's very similar, and we can give you a good case study about how other people are using the app in the same sort of scenario. But we can have a little bit of a meeting, Teams or Google Hangouts. We don't have to come and visit you these days. Everything can be done remotely. Once we've done that, we can produce you a free trial, and that's very handy, I think, for organisations when they've got an idea about how they'd like to use this sort of technology. We can put something together relatively quickly, and then you can use that and to go and show your colleagues or speak to patients about it. What do you think about this? What would you like to see? And actually use a trial app to be able to further that conversation. We say about 4 hours because I think once you've got it and once you've shown a few people, you can log into the back end and see how that kind of works. It's relatively simple beyond that, and it doesn't take too much, thinking about it once you see how it all works out, all fits together. Once we've got some kind of commitment from you, then we can go and deliver you the training and get you up and running. So I think your elapsed time in there, put in 8 hours. That might be over a couple of meetings or something. The quickest one we've done was with Wolverhampton CCG at the start of the pandemic. They wanted to produce an app for their care home managers. They wanted to be able to reach out to care managers and the staff, actually, for that matter, and then just update them, almost hour by hour as the landscape changed. But the deputy chief nurse came to us one morning and said, "This is my vision. This is what I want to do. Can you help us?" And by sort of late afternoon, she was emailing that audience out saying, "We've got a new app. This is the way that we're going to communicate kind of going forward. Could you share this with your colleagues?" And as I say, within 8 hours, they're kind of up and running. So we can be very responsive in that sense. I think that is about me. As I said, I rushed through it a little bit this afternoon, but I'm more than happy to have meetings, either one-to-ones or group meetings, or all of the above, in order that we can demonstrate the solution, how it works, and show examples of applications that are similar to your requirements, hopefully. So yeah, that is me. Thank you very much.
Thank you, Chris, as always. Yeah, a few questions, so we'll get cracking. Holly started things off here, so mind you, it's not a question from Holly actually, which you stated, but a great little comment. So not a question, but this is brilliant. My trust internet is so clunky and not user friendly. That's something quite commonly mentioned, Chris, when clients see the.
I mean, I think from experience, the trust internet is potentially a patchwork quilt, where some people that are putting content on are very experienced, have got time to do it. Others, are rushing things somewhat. So, people do, and I've worked in that organisation, walked in that team, and talked to lots of different teams about it. It's very, very challenging, I think. finding information. I mean, most people turn to the internet or the internet when they're desperate to find a resource, a policy, a guideline, a phone number, and under some stress. And a lot of these systems, a lot of content's not tagged properly, and trying to navigate around the menu system and find it, it's difficult, it becomes stressful, and and people don't like that. So having something that's very straightforward, very clear, has got to be the way to go.
Yeah, absolutely perfect. Little quick fire question here from Emma Morris. Does the app work with Android and Apple?
It does indeed, for both platforms. You can download it free of charge to your client. Obviously, there's a licensing charge that we talked about or I touched on earlier. But yeah, the app is available on both Apple and Google App Stores.
Brilliant. Lindsay Ford delved a little bit deep here. So does having systems like this that keep people linked in and connected at all times with news and announcements increase the risk of people not being able to switch off from clinical roles and reducing work-life balance? Good point, Lindsay.
It's a very good point. I guess that's up to the individual, isn't it? How much you do or don't want to use the systems. We're finding people are kind of desperate to get this information. It's up to you. Things like notifications can be switched off. You don't necessarily need to download the app in the first place. But we're finding with most of our clients that this is a benefit to those organisations, to those individuals, to have this sort of safety net of information available to them as and when they want them. There's always been people that don't want it, and that they can sort of kind of switch it off. I think for most people, this is definitely a benefit.
Perfect. Just a last quick one here. Thank you for the question, Lindsay. Stephen's asked, how do you navigate the extensive firewalls and security that surrounds the NHS IT system, and have you had any issues doing so?
We've only had a couple of clients thus far that have opened up those firewalls, and that's not necessarily a task that POs get involved with. It's the trust or the organisation. So we demonstrated one of the apps, I think, for University Hospitals Derby and Burton, where their network team have opened up a port for the Piota app to be able to then penetrate through and go and access the intranet. So it's going to very much depend upon the organisation and how happy the IT team are to work with kind of third parties. I think the examples that I've kind of given, they recognise that there are issues and they recognise the problems, and this is a fix and this is a solution. So being able to provide a little sort of half an hour's work to punch through the firewall saves them a lot of problems and a lot of grief going forward. So it's always going to be that balance. We are looking at integration, API integration into systems kind of going forward, but the majority of our connections will either be punched through a firewall locally or be a signpost to ESR system. So again, people can come to the app. Where do I get my payslip from? Oh, the payslip's there. I can go to ESR and you can go and log into ESR. We're just using the app as a sort of signpost rather than being able to log into it.
Perfect. Well, Chris, absolutely always a pleasure. A lot of people interested in hearing a little bit more, so just to encourage everyone to head into the handouts PDF, and we'll link you up with Chris directly if all else fails. So yeah, thanks again, Chris, and we'll see you soon.
Yes, guys. Thank you very much. All the best. Thank you for looking after us. Thank you.
Thank you.